Hi, my name is Steele, the National Sales Manager at Kilgore International. It's 2021 now. How can we give our patients a more tangible experience when we're trying to give them certain treatment? So today what we want to do is we want to show you the KPEK case and why it's important and why it's a must-have at your facility. All right, this is the KPEK case, and I'm going to show you why it's a must-have at your facility. Now, what I like about it is you have the carrying handle right here, so that way you can take it from consult to consult room, and or if you're a traveling dentist, it's also great for that as well. When you're ready in front of the patient to consult them on what they should do for treatment plan, you go ahead and just open it right up. You have all 6 models right here at your disposal to show the patient. Again, it's a nice demonstration, it's a nice display, very professional. And then now we're ready to talk about what treatment you recommend. All right, this is our first model. It's a K1 LOC2 Locator 2 model. And I love this thing because it's so tangible. And it's a great way to explain to patients the benefits of implants. So I'm gonna get a little bit closer here for you. To remove this denture, all you have to do, take your 2 fingers here, go ahead, pop up. Now you'll see on here, you have the 2 Zest locators, actual Zest locators, as well as the blue coplings. And what I love about this, being that it's actual, the real thing, you go ahead, put the denture over, you hear that snap. Patient hears a snap, you hear the snap, it kind of just registers with them. They can feel the retention on this thing. So now you explain to them, we could use that denture, and it's just gonna move around on you. Here's why it's so important to give you back some stability, so you eat the things that you wanna eat. So I love this model, it's a great demonstration. And it comes in your KPEK kit, and this adds that overall experience. Second model comes in this case. It's called a K2 Crown and Bridge model. What I like about it, it encompasses a lot of things. It's everyday talk you're going to have with the patient. So I'm going to come in a little closer here so you can kind of see the different restorative options on here. But you have an inlay right here. You have a gold crown. You also have this nice porcelain crown in the central. Then you have a veneer. You also have this posterior porcelain bridge. And these are all just held on with ortho wax, helps keep the parts tacky. But again, it's everyday conversation you're having, so it's a great model to pull out of the case whenever you're talking about any one of these options. So the next models are a K3 partial on locator model. Now I love this model for a few different reasons. Number one, if you already have patients that have partials, it's that great conversation to kind of bridge that conversation to, hey, maybe we should put a locator on there to have a better retention. So again, with this model here, I'm going to get a little bit closer so you see, but you want to be able to remove this model here. And then again, you could show that locator right here. And you have a thermoflex clasp versus a metal clasp on here as well. And when you're going to put this denture back on, just simply fit it over, and then you go ahead, snap it in. So very tangible. You hear that snap. You can obviously feel the retention. You have, again, thermoflex clasp, metal clasp. But again, it's just a great conversation to have with the patient. It gives a second option when you're thinking about partials. All right, this is our K4. This is our Valplast partial. Now, again, this is a flexible partial. You've probably seen it a million times, but it's just a great way to give that patient another option. So you go on here, you can show them. Again, I'm going to get a little bit closer here. You go ahead, take your 2 fingers, remove it off. Again, you can show that flexible partial. Explain how durable these are. I used to have a doctor that joked around with me about being able to take these things and throw them across the room, they wouldn't break. So that's maybe an extreme demonstration, but again, this is something that's a great model in your arsenal right here. It's something you can explain to patients as another option. All right, this is our K5. This is a bridge versus implant supported bridge model, and it's actually one of my favorite models. So what's unique about this, I'm gonna get a nice close-up for you so you understand kind of the uniqueness of this model, but it's all on natural roots, which is so cool. That way you explain to the patient, or at least have them conceptualize why the implant takes place to the root and why that's so important. And it also provides us a tremendous visual for them about how big that implant really is and what it looks like, kind of compared to the whole mouth. So what I do want to show you here is, of course, all your options. You have an implant supported bridge. You have a single tooth implant. And then you have a natural bridge. So it gets everyday conversations that you're having with your patient. And if they're deciding whether to do an implant or a bridge, now they can make an educated decision based on that, based on your consult, and based on a very tangible model about what's the best thing they need to do. All right, this is our case 6, and this is our screw-retained hybrid denture. Now, when I say screw retained, it really is screw retained. So this one is fixed on. It's on 5 implants. I'll kind of just get a little bit closer here so you can see what the model looks like. But you have all 5 implants right here. Mandibular denture. You could also see the screw holes as well. Now, I've had questions before. Can you take out these screws? Yes, you can. I don't recommend it because sometimes it takes too long in front of a patient. And they kind of lose their focus a little bit. So I always just explain to them, hey, it's a screw retain feature. We can remove it if we need to for cleanings and things of that nature. But otherwise, it's going to stay on right here. So it's a great case to explain. It's a need for a lot of different people. And this, again, gives you something tangible to show them why this is important. Hey, we hope you all liked the video. Be sure to like, subscribe, leave a comment in the comment section if you get the opportunity, and check us out at KilgoreInternational.com. We're going to see you at the next video.